Hey everyone, thanks so much for joining us today. We are doing our third quarter JMA webinar, our first one that we're posting to YouTube, and we're very excited about our subject today. We're talking about Medicare, specifically the insurance coverages with that. It's a really important part of everyone's retirement plan, but it's often misunderstood, very confusing, and we wanted to kind of shed some light on that to clear up some of the noise and answer some of the questions we hear regularly. And instead of me trying to do that, we've brought in some experts in the space. Today, we're joined by David and Beth Stewart of Black Bear Insurance. They're going to help us understand some basics about how Medicare works, what you need to do, and when to enroll and avoid penalties. So, David and Beth are licensed and independent Medicare brokers covering New Mexico, Arizona, Colorado, and Texas. Their business, Black Bear Insurance, has been serving Medicare clients for the past 7 years, and you can find them online at blackbearinsurance.com. David, Beth, welcome. Thanks for joining us.
Thanks for having us.
Let me jump right in. First, I've mentioned that you guys are Medicare brokers. What is it exactly that you all do?
Well, thanks for asking. And first of all, as a Medicare broker, there are a few disclaimers that we're required by Medicare to mention. One is that we are licensed insurance agents. So we do not work for the government agencies of Medicare or Social Security. And as licensed agents, we are independent, meaning that we work for many of the companies that are available in New Mexico and represent plans such as supplement plans, Advantage plans, and prescription drug plans. But we are required to tell you that we don't represent every single plan. Medicare.gov is the place to go to see every single plan that's available in a person's zip code.
I would just add that we are in your corner. Our job is to serve, right? And so as Medicare brokers, we are the ones that help people navigate the space and learn about Medicare. We do lots of educational trainings like this and others. And we don't have a dog in the fight. We don't care what you choose. We want you just to understand so you can make the best decision for yourself.
Yeah, so we have a lot of folks that try to navigate this on their own because that's kind of most people's knee jerk is that they're going to handle this on their own. What value does a broker working with someone like you? What kind of value does that provide?
Well, first of all, we do not charge for our consulting, so it's no cost to the person who meets with us. And like David said, we are in that person's corner. We are like an advocate to help navigate Medicare, all things Medicare, educating them, but also there's so much information that comes to someone who's getting ready to go on to Medicare, and it's really difficult to sort through all the information to know what applies to me, where my enrollment periods, I want to avoid penalties. What should I sign up for? And we just help people guide them through those decisions. We do a lot of asking of questions, listening, finding out what's important to people, and then helping them make those decisions. And also, we don't just help people initially enroll. We also, once someone is our client, are with them throughout the year and from year to year as they're making decisions about their health care. So we love being available to serve people and to help them with these decisions.
Yeah, that's really helpful. So there's no charge for the consulting services. You guys are kind of another part of their financial advisory team. If I could, include you guys in that bigger picture. Oftentimes we look at ourselves, of course, as the planners, the CPA, or the tax advisor, the attorney. But really, we get the insurance specialist, whether it's the life and health and those kind of folks, or if it's the Medicare side of things. So that's really good to know that you're just another member of the team, really. So looking into the practical steps here, the first thing is when do people sign up for Medicare?
So There is a calendar to Medicare, and enrollment periods are very important. So the first thing on the calendar is enrolling in original Medicare, and that is the the Medicare that is part of the federal health insurance program. So there are two main time periods to enroll in that. And one is around a person's 65th birthday. It starts 3 months before their birthday month, and then it goes through 3 months after their birthday month. There's also a second initial enrollment period for people who decide to work past 65. And that is if you work for a company that has 20 or more employees and that company offers group health insurance that is considered creditable, then you can postpone enrolling in Medicare until you're ready to retire. So that second initial enrollment period would be when you go off your group insurance after turning 65, if you're older than 65. So those are the two initial time periods that you need to consider when enrolling in Medicare. This is the first step, which is that federal program. It has Part A, which is hospital, and Part B, which is medical. And it's important to know that there are costs with that. Um, you've already paid into through your taxes, but Part B has a premium, just so that people are aware that they have that cost that's going to come up. And right now, that Part B premium is just a little under $200 for most people. But if your income is high, you pay what's called IRMA, which is an extra fee for that Part B and for Part D. So if you are on original Medicare only, um, you also pay 20% of all of your bills. So that's kind of the calendar and then some of the costs to expect on original Medicare.
And you don't have to stay with your employer group coverage past 65. That's kind of one of your first question points related to the cost, because for some people it's less expensive to get on a Medicare policy right away if they're paying some of their own out-of-pocket medical care through their group plan. For others, it's advantageous to wait, depending on if they have to pay some of that IRMA, some of those extra costs. So that's a great time to introduce yourself to a broker or to start the process of learning this new language called Medicare and figure out, should I stay on my group? Should I wait till I retire? How does it affect the dependents in my family, and so on?
And another note is after age 65, COBRA is not considered creditable. So a person just wants to make sure that they're covered by a creditable plan after age 65, because if you're not, you can have penalties. So just keep in mind COBRA is helpful, but it's not considered creditable after age 65.
Here's the big thought. The government wants you to have health care at least from age 65 forward. And creditable coverage is what they have defined is the part that you need to have, the correct coverage. So whether you have it through a Medicare plan, whether you have it through your group at work, those are the two main ways, but not COBRA past age 65.
Got it. That makes sense to me because after age 65, you're supposed to have shifted on to Medicare if there's no other coverage. So that would make sense that Cobra doesn't apply there anymore. And you guys have talked a lot about IRMA already. Any of our clients that are in their retirement years should be well aware of that. That's something we bring up a lot, especially when we're talking about charitable planning or Roth conversion planning or income planning. Very important to be aware of that. So I'm glad you guys are bringing that up too, hearing it from multiple angles. So when it comes to Medicare, I do see advertisements a lot. There'll be I think Tom Selleck's on some of them, great mustache, but he's selling some Medicare Advantage plans. I hear that all the time. And I know there's different types of Medicare insurance that you can get on top of what the government provides. Could you shed a little light on that?
Sure. So once you are on original Medicare, then you have a choice to make of going on to a Medicare plan. And there are two main categories. One is the Advantage plan that you just mentioned. And the Advantage plan are plans that are run by private companies that have a contract with Medicare. So these plans are very similar to what people are used to through a group plan. They're HMOs and PPOs primarily. And these plans, we like to talk about cost, care, and coverage. So the cost of these plans, you still have to pay for your original Medicare, that Part B and the IRMA, that's still going on. But these plans often have a $0 premium each month or a low dollar premium each month. And then you pay as you go. So these plans, you pay a copay or coinsurance as you receive services. Um, Also, these plans have what's called a maximum out of pocket. So as you're paying copays and as you're paying coinsurance, if what you've paid in a year adds up to a certain amount, then you don't have to pay any more for the year. So you have a safety net with these plans. So as far as coverage, these plans um, allow you to um, have all of your Part A and Part B that original Medicare offers are covered. You're guaranteed that those benefits are covered for hospital and medical, but they also include a lot of extra perks that aren't covered by original Medicare. So these are the kind of plans that are going to give you a dental benefit, a vision benefit. They may have a gym membership or an over-the-counter benefit that you can use every quarter. So they have a lot of extras built into the plan that make those plans attractive. Um, but we also have to consider the care. And so these plans have what are called networks. So you have to receive your care from providers who are in the network, which would include your hospital, your doctors, your nurses, your pharmacies. You have to use doctors that are within the network to get all these extra benefits that are in these plans.
Yeah, that's really helpful, and it probably sounds familiar to folks that maybe they're not on Medicare yet. They haven't explored this, but that sounds a lot like the insurance that me and my family are covered under the JMA insurance, where you're talking about deductibles and copays and out-of-pocket maximums. That sounds very familiar. Um, isn't there an alternative to Medicare Advantage plans? What's the alternative, and what are kind of the pros and cons there?
So if you don't sign up for an Advantage plan, which covers that extra 20% of Medicare with copays and a maximum, as Carol Beth alluded to, a lot of people get on a supplement plan. And the supplement plan leaves the federal Medicare in place, your A and B, and then it catches everything that Medicare A and B don't pay for. If you think of an Advantage plan as the all-you-can-eat plan, because they throw in, dental and vision and hearing and the kitchen sink, if you will, right? Then the supplement plan is the a la carte plan because they separate the medical and the Part D prescription drug and the dental, vision, and hearing. A supplement plan, the ones with the most benefits, cost, you know, upwards of another $200 per month in premium. And then you pay a small deductible, like $260, and they pay the rest of your medical for you for the year. So it doesn't matter how many times you go to the doctor, how many times you're in the hospital, how many surgeries. The other thing people love about a supplement is the freedom to go see anybody in the country that takes Medicare. So all the providers outside of your network that you would be limited to, in an Advantage plan, you're not limited to in a supplement plan. Now, there are different flavors. We're kind of flying over the city here at 35,000 feet, looking at big picture stuff. But know that the supplement plans with the most benefits cost upwards of $200 a year when you start. They go up every year in price. And then they cover everything, they catch everything that Medicare for the medical doesn't cover. But now you have to have a prescription drug plan. You have to have a dental, vision, and hearing plan in theory. Insurance changes every year. They package and depackage all these things depending on your state and so on. But these are some general ideas.
Yeah, that's really helpful. So it sounds like you said the Medicare Advantage is something of an all you can eat, and then the supplement is a la carte. So you kind of pick and choose what you want covered. Do you guys have a propensity to lean one way or the other? I imagine it's a classic "it depends" answer here, but do you find yourself placing people in one or the other more frequently? What does that look like?
That's a great question. Really, when we sit down with someone, that's one of the first things, that's one of the first decisions for them to make is which is better for them. And again, it kind of goes back to that cost, coverage, and care. What is most important to them? And so we ask them questions. A lot of it depends on um, what they know about their own health and how they want to navigate, paying for those services. So really that's our first question, and we ask questions to help people know which way they want to go. Another interesting thing is when you can sign up for one of those plans is a little bit different. So going when you first go on to Medicare, you can go on to a supplement plan fairly easily. It's called an open enrollment, where you can sign up for one of those plans without medical underwriting. But for a supplement plan, if you come back to it later after you've been on Medicare for over 6 months, you have to go under medical underwriting, where they can ask you questions about your health and your health history. And you may or may not be able to get onto one of those plans. So sometimes people will start with a supplement plan because they can get on without the medical questions, and then as their premiums get higher, which they do with a supplement plan, they can easily change to an Advantage plan later. So sometimes that happens, but a lot of times people come into the office and they just, after talking about it, they know which one seems more comfortable for their personal needs.
With a supplement plan, you might not be able to afford it. So that could take you out right away. You don't think you can afford the monthly premium. The flip side is if you have an Advantage plan and you're in the hospital a lot and you've got lots of specialists, and God forbid you'd have to go through cancer, it might be less expensive if you had been on a supplement plan. So you pay every month for a supplement plan whether you need it or not. And it's hard to make those payments when you don't feel like you're using the medical service. But you need to be thinking down the road of what kind of plan do I want to have when I'm 70 or 75 or 80? And that might help you get into a supplement plan early. It is a case by case basis. I'm a type 1 diabetic. I've had lots of health care needs. I've been in ICU on a ventilator. So I'm going to get on a supplement plan as soon as I can because I believe I'll take advantage of the extra benefits. But my wife, who's more of a healthy person, she's always been on something similar to an Advantage plan. That might be appropriate for her. So even couples can be on different plans depending on their unique needs.
Got it. That's a really important point that can be often overlooked is that medical underwriting and when to get on the supplement versus an Advantage plan, or if you want to leave or bounce around. Really important to think about your family health history as well as your own. So that's really helpful too. Now, I think I might want to back up a minute. I think we might have skipped a step here. We've talked through the kind of alphabet soup of Medicare. Would you guys mind just taking a moment and kind of just laying out the different parts A, B, C, D? Is Medicare supplement part of it? Is Advantage? Could you just spell that out in layman's terms for anybody watching?
Sure. It is hard. It is like alphabet soup because there are a lot of letters. So, original Medicare has Part A and Part B. A is hospital, B is medical. So if you go with a supplement plan, it has to cover your Part A hospital and Part B medical. If you go with an Advantage plan, it has to cover your A and B. So those benefits are always included. If you stay with original Medicare by itself, if you add a supplement, or if you go with an Advantage plan. So sometimes Advantage plans are also referred to as a Part C plan. So that is a little bit confusing, but the Part C Advantage plan means exactly the same thing. It's just two names for the same thing. Part D, we think of D for drugs. Part D is the prescription drug plan, and it is very important when you go on to Medicare to have that prescription drug plan because if you don't have the prescription drug plan, you'll receive a penalty for every month that you weren't covered. So it's really important. That Part D can be a standalone that you can just have with original Medicare or a standalone prescription drug plan with a supplement, or most Advantage plans include that Part D. So that kind of answers a little bit of the alphabet.
Some people call uh, Part E is a supplement plan, just to kind of include it in the mix there. So there's A, B, C, D, E.
Yeah, thank you guys. Maybe that was for my benefit as well as everybody else. It's easy to get confused by that, especially as you're entering into this new phase of life, and you're maybe you're sneaking up on retirement, thinking about filing for Social Security. You're not sure how that IRMA thing works, and then, gosh, all these letters are hard to keep track of. So thanks for breaking that down. One thing you guys mentioned, and this is a little bit out of left field. You guys had mentioned, doctors and networks and coverage. We've got a lot of clients that travel internationally. How does Medicare work, if at all, internationally?
I would say in general, there is a little bit of coverage, but in general, you should get a plan with your, cruise package or with your tour package to have a travel insurance policy. That's what we recommend. There is urgent care and ER anywhere in the country on any plan and in some neighboring countries, but I can't make a blanket statement that no matter where you are, your Medicare is going to work. Medicare is made in the US, right? And so think of Medicare for the US. And when I travel out of the country, I should probably have a travel insurance policy. And those, you can get a 2-week travel insurance policy. If you live somewhere else, you cannot get Medicare. Um, Living in Mexico, right? It's for US citizens in the US. Again, there are maybe a few exceptions, a little bit of care, but I wouldn't think of it that way. I would think of it the opposite. Medicare is for people, US citizens and people who are here legally for care in the United States.
And are there any state to state or geographic within the United States considerations, or do all these plans cover everybody everywhere as long as they're in the United States?
That's the Advantage Plan thing. Advantage plans are geographical. We talk about in-network, and part of their network is the territory. The cost for supplements might vary depending on your zip code, and Advantage plans, though, are created within individual states, sometimes per county or multiple counties. So when you move, you get to start over with an Advantage plan, and your pricing for your supplement plan might change.
Good. That's, again, very helpful. Considerations that I think are often overlooked in the planning process, which kind of leads me to my next question is, uh, Do people really need a broker for Medicare? Our conversation so far today suggests yes, because there's a lot of nuance and difficulty to making these decisions. But uh, what would you all say to that question? Do I really need a broker for this, or can I just do it myself?
This is one of my issues with responding to mail and TV, all the famous quarterbacks telling you about Medicare. They don't know anything about Medicare, I promise you, right? They're just giving an endorsement. And when you call, you don't always know who you're talking to, often a call center. And if you have a question, you call back, you're probably not talking to the same person. We know a lot of people who feel independent. They might say, well, I do my own taxes, I can do this. Well, we're kind of like, allowing you to do your own taxes, but we help you along the way. We're there to check for loopholes or your certain medication. We drill down through, over 1,000 pages of rules and regulations to help make sure. We might come back and say, I think that's a great idea and give you an endorsement. But in general, as I've learned about this from my parents when they were going on Medicare, not knowing anything, I thought, wow, this is a huge needed service for individuals and for families, especially since it's no cost. And you've heard us cover, if you've been listening, you've heard the C's, right? Who's in your corner, right? Cost, coverage, care. First, think about the calendar. So these kinds of things we can help you navigate through and know when to do it. You don't have to use a broker. I don't know why you wouldn't, but you don't have to use a broker.
And one of the things that we love about our jobs is we really build relationships with our clients. And it's not just to enroll someone in a plan, we are there for them throughout the year. We talk to our clients throughout the year as they need help managing their insurance. They can call us with questions. If we know the answer to the question, we walk them through that, or we connect them to the right person to help them with their need. And then throughout, as the plans change from year to year, we are the person they can come to and say, how is my plan changing? Do I need to change to a different plan? Should I stay on this plan? We walk them through that year to year. So we think it's a great benefit to our clients to be able just to have someone in their corner to help them with those decisions, with changes, as they come across things in their plan throughout the year that they need further information. We can provide them information. So it's a great benefit, not just for enrollment, but throughout the year and from year to year.
Yeah, that ongoing service and the annual check-in on, am I still on the right plan? Has anything changed I need to be aware of? I'm certainly not an expert in that space, so at least I know who to refer to when I have questions there. Um, One, I think, last question that I have is, what are some of the biggest mistakes or stumbling blocks that people make, whether it's um, not signing up in the proper window, or maybe not getting on, the right letter on the alphabet soup, or maybe signing up for the supplement when they should have had the advantage. What are the biggest, most common mistakes that you see people making?
I One of the mistakes I think it's when people respond to the pressure from cold calls, or responding to advertisements on TV. And I think the reason it causes problems is there's misleading information. A lot of times, things that are advertised on TV, or when people are making cold calls, they do not know what is appropriate for a person. And they sometimes are offering things that really aren't even available in the person's zip code or available to them financially. So just be careful. That would be my advice as you watch commercials, or some of the mail that you get, or a cold call that you receive. Just know that some of that information may not be accurate, and it's better to talk to someone local who can help you walk through and know which things are really available to you.
Yeah, and this has all been really helpful. Is there anything that you would like to share as kind of a final thought or a final takeaway for our audience that maybe we haven't discussed, or bringing something full circle that we have already discussed?
It doesn't cost anything to meet with somebody. And just because you meet with them, you don't have to use them. But hopefully they can start your education process. Everyone has to learn this new language of Medicare. You got to learn some of the terminology, and it helps to have a friend. It helps to have someone in your corner. So calendar, cost, coverage, care, and who is in your corner? That's the question to ask.
Yeah, well, thank you both so much for sharing your expertise today. I learned a lot, and I've got some letters behind my name. I've dealt with Medicare and the insurances that can be attached to that over the years. But thank you for shedding some light on an otherwise very complex topic that can be a little bit scary to tackle going into your retirement years. So I sincerely hope that this session has brought some clarity on Medicare, the role of supplements, advantage plans, all that can play. Now understanding the alphabet soup, and probably my biggest takeaway is all the C's that you've shared. The having somebody in your corner, the calendar, the cost, the care. I feel like I'm missing one, but you guys did an excellent job really summarizing all of it. And I know there's much deeper that we could have gone, but I hope that this will be a catalyst, another C, for folks to reach out to you or another broker for some help. If someone does want to enlist your services to get you in their corner on their team, how would they best get in contact with you?
Well, you have our website, blackbearinsurance.com, or you could call us, of course, at 505-620-7175.
Great. Well, David, Carol, Beth, thank you so much for taking the time this afternoon. We really appreciate all you do for our clients here at JMA and for the resource you continue to be for our team. So thank you for joining us, and thank you for everybody for watching. If this was helpful for you, please feel free to like and subscribe to the channel, sign up for notifications for all future videos. We would really appreciate that. And if you know someone who's about to get to Medicare age, share this resource with them. We want this to be a blessing to our broader community. So feel free to share this resource with anyone who will help. So thanks so much for watching. David, Carol, Beth, thanks for joining us.
Thank you,
Thank
Cole.
you.